Thank you for the kind words, Meenakshi. And at the outset, thank you, Shubda. Thank you, Cheryl, and the DAYDEIC team for inviting me for this talk and an interesting topic. Yes, I need assistance just to change the slide. So I'm just going to say next. Yeah, can we have the next slide, please? Yeah, so we first deal with sick day routine. There is a gamut of things I do want to cover. So next. We all know what happens in a sick day routine. It is actually classified as an intercurrent illness. So whether there's diarrhea, vomiting, or fever, a diabetic, whether type 1 or type 2, we have to cover the entire gamut as an educator to understand what happens. And that is what is where the insight is needed. Next. What are the basics? Now, there can be that a patient is either on insulin or oral medication, but even if there is an intercurrent illness where there may be diarrhea and vomiting or either, we do not normally totally omit the insulin or the medication, even if the patient is unable to eat, because there will be certain basal insulin required. And I think as highly experienced healthcare professionals already, we all know that, this is more applicable in a type 1, where there is a basic insulin needed for survival. So this is a word of caution to diabetes educators that do not allow the patient to completely stop the insulin. Because even with poor food intake, you might find that there can be hyperglycemia. Next. So there has to be regular testing when there's a sick day routine. And all of you may be a lot aware of this already with dealing with so many patients, is that every 2 to 4 hours, minimum 4 times a day, to ensure that you can modify the oral medications, the insulin, or the food intake. It applies mainly to a type 1 diabetic. You also need to consider the DKA, and that is very important. Now, we have found, and it has been seen over experience, that sometimes they completely stop the insulin in a type 1, and that actually can lead to death. So this is something that has to be made and conveyed to an individual when you actually a type 1 is treated, and the family made aware that any such intercurrent illness of gastrointestinal nature or anything, we have to watch for this, and insulin is not to be discontinued. Next. So there may be extra insulin sometimes required at that moment if there's hyperglycemia. So also in a type 2 diabetic, it's not necessary that if they are on an oral anti-diabetic drug, that only you continue that. They may be switched to insulin for a short while, just like you do, pre-surgery, and then, you again go back to the OHA's post-surgery. So that is something that can be done, which will give better tuning, better control, and will be able to treat that individual or patient better. And sometimes certain drugs may need to be omitted. So as a diabetes educator, we need to be able to guide a patient to understand that they need to, connect with their professional, their doctor, so that you can be the bridge between that to give them a clearer understanding and make sure that they do not omit something which is required and take something that is not required. So I think there is a very fine line here that needs to be understood and conveyed. Next. So we know that, yes, the nutrition and the fluid intake also needs to be taken into consideration. If they are too ill to eat or drink or tolerate anything, then yes, hospitalization would be the answer, because then there would be a trouble both ways in retaining food as well as they're losing, liquid and hydration. So there has to be good hydration. There may be at that time whatever they can consume, even if it may be having certain sugar, because remember, you can control the blood sugars with the insulin at that point. So there it becomes imperative to allow the intake, even if it is a sugar-based intake for that short period. So overall, you can find that maybe the diarrhea may be treatable, but sometimes even an IV may be required. But if at a home situation, this is the best set at this point that you guide them. And after that, if they do need to visit the casualty or the doctor, that is also to be conveyed. Next, please. So overall, in a sick day routine, it will completely depend on that particular situation of the intercurrent illness of the individual. They're definitely not to immediately start exercising the minute if they're feeling weak. They have to recover and then be told that their food, their activity, and their medication is all to get aligned again. Some of these I'm giving you as a nutshell idea, because what exactly is being done in the medication, insulin dosage, and the nutrition we all know, but exactly how to manage it in totality and wrap it up for them and to make them know the do's and don'ts become very important. And obviously, if there is any kind of retention of either through diarrhea or then they're not able to consume anything, that is an absolute warning signal to contact the physician or the hospital. Next, please. So the further help has to be accordingly sought from your the diabetologist and the diabetes educator. Next. Now we come to a very important aspect that we all face today with all our patients and ourselves is the traveling and eating out. Next, please. Yes. So when there is travel, many of the individuals and patients do not know what they have to do. So as a practice and as good clinical practice, we have always been following where they have to carry their prescription with them. That goes without saying on anybody who is on the particular oral medications as well as on insulin. That prescription becomes very important to have on them while traveling. And usually as good clinical practice, as a diabetes educator, we should know that from the physician or the diabetologist, there is a letter required which gives a summary of the particular patient's condition, whether type 1 or type 2 or any comorbid conditions, complications, so that any other doctor in any other country, city, state is able to understand the situation without having to really speak to the relatives. But that letter should be carried with them. It sounds very silly and simple, but this actually is of great help. So when there is air travel are being undertaken, we know that there are sometimes a huge difference, mainly in international travel, of time zone changes. Within a country, it may not matter, like when you're traveling within India. But at that point, also, one needs to know that in both these situations, there has to be an extra packet of, or what you call a kit that is made, which is the medication kit, which has, suppose, the insulin, it has the injections, it has also the medication. One has to carry extra supplies, because sometimes you may not get that particular dosage, you may not get a supply suddenly if you're caught in a bad situation, if the travel or there are delays in travel. So even whether air or road travel, there has to be extra supplies that have to be carried. Now, with respect to air travel, you'll find that sometimes the insulin dosage has to be explained to a type 1 or a type 2, because it depends whether one is traveling westward or eastward. Because when you go westward, you're actually gaining time. So again, the insulin dosage has to be adjusted according to what time they reach there and that gap that needs to be covered. And whereas when you go eastwards from India, you'll be losing time, you're going ahead. So already the time zone has been gone through. And so they have to connect and go into that clock, into the clock, the particular international clock, go into, when you go eastwards, you have to adjust the dosage accordingly. So these are very important points to remember to convey to a patient, and that dosage has to be explained and given in the prescription that you add this or you minus this. So that dosage schedule has to be provided. Second, yes, if they're on an air travel, you can have the diabetic meals that can be offered and they can be pre-ordered, so they can be advised to do that. Also, it is very important to remember that all the insulin supply or medication supply has to be in the handbag in eventuality and not in the check-in bag. Because one, the insulin vials or the insulin will deteriorate. They will not be, because that goes into the bottom of the plane and that can be, the insulin will get frozen. So it has to be in the handbag on person in any kind of travel. Next, please. Yes. Now, as far as road travel is concerned, yes, one may stop on the way if a person faces hypoglycemia. That remedy of hypoglycemia has to be explained during travel, and they have to carry the ready foods, which I'll explain, or snacks, which have to be accessible to them apart from water and good hygienic drinking water, so that they can either stop on the way and grab a snack or meal somewhere, or it's on person in the flight or even in the road travel. On flight, one can usually ask for it, but if there's a certain specific need of meal or a certain food, then it's better to carry it on person. And specifically in road travel, when in our country, sometimes you may have, if you go in the interiors, there may not be, any kind of restaurant or anything available. So it's better to have those carry-on foods in the car with you. And of course, also the pouch, which will have the insulin supplies. Now, in a car, it is not to be kept in the boot. It has to be kept in the bag, in the AC where you actually sit, and neither in the boot nor if maximum, sometimes people do keep it in the glove compartment. But if it is very hot, the outside environment temperature is very hot, you can actually have a denaturing of the insulin. So that is why it's very important to keep it on person and within the actual passenger area that you're traveling in. Next, please. Yes. So what are the kind of foods you would carry? Yes, a ready, snack in the handbag. It could be a sandwich. It could be chana. It could be nuts, which are easy to carry. Remember that most diabetics, whether type 1 or type 2, they have to be careful of getting gastroenteritis. So when traveling, it is important to have safe, hygienic, portable water on them. Also, the kind of foods may be very deep fried or very heavy. Then they may not be able to digest it very well or have any kind of stomach upset. Therefore, the choice of the food as carry foods is very important when you stop over and have something, or when you're carrying them, you have the liberty at least of carrying the right kind of foods. And you want them to be not to be very heavy, fatty foods, because sometimes when you have a very heavy, fatty or protein meal, we don't realize that actually there is a dosage of insulin needed even post meal, because there's a certain dose that covers the carbohydrate count in that meal that we normally do. But if there's a fatty or protein meal, while traveling, one needs to know that a small additional dosage may be required later, because it may still spike the blood sugars post 3 hours, if not 2 hours. So that is very important to remember. And of course, the remedy of the 15 rule of hypoglycemia is always to be explained to every patient that walks into the clinic through the diabetes educator. Next, please. So there are many healthy versions of the foods that can be carried, and I've just listed some of that. I'll go through it quickly because we have a certain slot and a lot to cover, but I wanted to take these as take home messages. They should opt for obviously healthy versions, which are whole grain cereals, whatever they can get when they travel. If it's not, that's the version you carry from home. Next. Yeah, you have to avoid the maida versions of food completely. Next, please. Next slide, please. I have the slide frozen. Yes. So the cuisines. Now, when an individual who is a type 1 or a type 2 or traveling may face a lot of different cuisines, whether they're traveling or whether one is eating out, I think they're quite in synchrony that either we'll end up ordering in today, either a person is traveling and visiting and there are different restaurants on the way that they need to avail of. So there are different cuisines where we normally shortlist certain things off the menu and give them as a as a handbook that these are the things that you can avail of. And when you're availing of these particular cuisines, these are the things that you can have off the menu. So if they find that, then well and good. Or normally they will have that carry food interim, and then when they reach the correct place where they can avail of the food. So it is imperative that they do understand the different cuisines, and therefore the eating out during the travel also has to be explained. So it's like a double-edged sword, because they're also eating, traveling, as well as they will end up eating out if they do not have as much of the carry food on them. So some of that has been explained here to know which options are better, healthier, so that they're avoiding the absolute maida in the foods. They're avoiding very heavy, creamy foods. Also, salads, we say yes, but only from a reliable place, because we do not want any of the raw or cut salad or any raw food to cause any GI problems of diarrhea or vomiting or any food poisoning. So even though mentioned, that will be with caution. Next, please. So there can be different cuisines that need to be covered, which are just, I've just given a glimpse of that here. And that can be, then the dosage can be taken accordingly. So that is explained to the individual according to their travel plan. So in fact, when we have patients with us, we are hand-holding them as an educator to explain to them not only the nutrition, but that entire pivotal point of their medication, what is the dosage given, according to the food they're going to get, depending on which country they're traveling to, whether they're traveling in India or outside. And then we kind of bring it all in synchrony and give them those key points. Next, please. So there are different cuisines here. Next, please. Now we move on to a special situation I really wanted to discuss in life, which is apart from travel, is the religious fasts, which are normally not much spoken about or not much dealt with, and usually directly dealt with the diabetologist. Next, please. We have the Ramadan fast. We are all aware how the fast works. What are the features of all, whether it's a Ramadan, Shravan, or Jain fast. In our country, which is so multicultural, we are very well aware of the different fasts. So I've just listed that out for a quick understanding. But next, please. Yes, so the distribution of the meal has to be made very carefully. And the key point to remember as an educator is to educate the patient to know, even though the diabetologist may be writing it, that their entire dosage of insulin medication is completely switched. The morning becomes the evening and the evening becomes the morning. And there's a complete diurnal to, nocturnal shift, because the iftihar is happening post sunset and the sahari is happening early in the morning. So the dosage will be completely switched. And when that happens, it is important to guide them how to keep the synchrony between the fast and the food intake and the dosage they are taking, because by the clock, you're completely reversing it. So in a Ramadan fast, that is kept in mind, and many who will be, obviously the diabetologist will decide whether a patient is well controlled to undergo the fast. But if they do undergo the fast, then it will be followed in this fashion, and the meals that need to be taken along with it, apart from switching the medication, and reversing it, will be a next, please. I'll explain that. So the recommendation, yes, the hydration has to be good when they can in the period of eating. They have to avoid very strong caffeinated beverages, because sometimes they have a hypertension, if they have anything, their blood pressures can shoot up. So we have to take into consideration comorbid and complications. There has to be a balanced meal. So usually if there's a high protein intake that may be needed, or the foods are should be of lean meat version, there should not be fried fatty meals, not very high in carbohydrate or in fat, but more protein rich, but yes, the lean meat options. Next, please. So that covers the Ramadan fast. Now we also have the Shravan fast in our country, where sometimes it's followed only every Monday, once a week, or right through the month of Shravan, where certain foods are permitted. So in each of these fasts, there are certain foods permitted, and we have to understand as educators, not only as being nutritionists, but to put them in tandem with their dosages. So in a Shravan fast, I wanted to just bring to your notice that it is a high carb meal comparatively even to the regular meal that the individual may be taking. And sometimes the dosages have to be revised upwards to cover that carbohydrate count. Next, please. Yes, so the foods in a Shravan fast which are avoided are as above, but the foods permitted are the following. But they tend to be more carb containing, apart from maybe some of them which are listed here, which may be more in the millet version, or maybe actually non-cereals like buckwheat, amaranth, or rajgira, as we know. So some of these are the ones that actually get included or are recommended. Next, please. You'll find that you'll have the grains which are there, maybe more of these types, which are more millet or non-cereal based. It has to be a nutrition balanced meal in all the religious fasts. And the foods that have to be opted for, again, have to be low fat, or in the milk and milk products. The fruits can be consumed, but all of these have to be worked out depending on the glycemic control of the individual. So whether it is a Ramadan fast or a Shravan fast, you will still try to have them have the balanced meal in the timing that they can consume it, and not have long hours of fasting. And if it is in a good glycemic control, then the individual may be allowed those long hours of with abstinence of food. But yes, the entire dosage will be changed accordingly and to cover the meals. So the prandial glucose becomes very important apart from the fasting glucose when you are following up these individuals. The next fast that we come to next, please, is the Jain fast, where there's a variety of fasts. Some are very severe and rigorous, but and sometimes they're not recommended for individuals who are not well controlled at all. And usually they will be very selectively recommended by a diabetologist, because if they're extending for long term, then the person can even go into a ketotic state. And that's why it is important to really, the patient has to be, only if allowed, will be undergoing this. Others, because there is a long periods like an intermittent fasting almost, but there is no water either. So they are less recommended in an individual unless they're at least eating one meal a day, which is known as a kashna, or two meals a day, which is known as a biashna. So some of these things have to be understood as to what extent the individual be allowed a religious fast. Of course, in coordination with the educator explaining everything and the diabetologist allowing it. Next, please. Now we come to a very important scenario that I have found over a period of years with people who are now working from home, or whether they're going to work. So it has become, with COVID happening, we are in a in a dual system of work system where people are facing a shift work. They do a lot of shift work systems. Next, please. So these are situations in life where, to keep the job, the challenges that are faced, that you cannot refuse to do the shift work. I see a lot of that in the IT industry, where there's a huge disruption of the circadian rhythm of a diabetic, and that there'll be massive blood sugar fluctuations because of the irregular meal and sleep pattern. So hence we need to work that out within the schedule. So usually work on it like a clock, a 24-hour clock if they're having night duties, shift duties, etc. And you actually have to tell them that if from a breakfast, which is typically in the morning, to the lunch at 1 p.m., to the tea time and to the dinner, you completely reverse the clock. For example, I'll tell you in a simplistic way, their breakfast becomes like their 6 a.m. breakfast becomes a 6 p.m. or a 7 p.m. or an 8 p.m. dinner. The dinner becomes like a morning breakfast, and their lunch becomes like a mid morning 2 a.m. Kind of meal. So you completely reverse it, and accordingly, even their dosages will be reversed, will be set accordingly, and that has to be brought to the notice to the diabetologist, because it's the job of an educator to understand the lifestyle, the work pattern of the diabetic patient that you're treating, and bring it to the notice of the diabetologist and bridge that gap to bring about that change in the schedule. Unless we don't make the diabetologist aware that this is what is happening, it will not come into fruition to really help the individual, and their blood sugars will still be haywire. Next, please. So what really happens is that they have to set reminders for their dosages, for when they have to take their medication. The insulin will be rotated accordingly to their shift work. The meals yet have to be balanced, which we all know how to do that if we are a nutritionist. But as a healthcare worker, also you are actually everything rolled in one. So we have to know how to readjust those, and to avoid those high fat, quick fix foods, or the cafeteria foods. So there are sometimes meals that they can take in a tiffin from home, some carry foods that they keep at their workplace, some that you have to ask, is the cafeteria meal on? Then we have to help them select that from a menu. There's a lot of work that goes in, because it all has to be in tandem with their particular medication and the schedule on the lifestyle of the individual. Next, please. So in a shift work, we have to emphasize that they keep their sleep pattern as much in that zone as possible, because they may be sleeping in the day and being awake in the night on a regular basis. So the entire rhythm being the other way around, they need to develop it, and then it again changes. So they literally go like that, like when a person is at work and traveling a lot and through different time zones. So a person on shift work is facing a similar situation, and hence we have to work it out on a regular basis and give them those several schedule plans, not just one. And then they know how to, you empower them to understand how to switch it themselves, still to continue some physical activity, and not completely, have no time to do that, because it affects their glycemic control if they're very sedentary, and to also be not affect the sleep and have some meditation, which all goes hand in hand as a lifestyle pattern today, and as wholesome living as well as, healthy living. So it all goes together, even for a type 1 or a type 2, in any of these life situations. These need to be put in inclusively for them to be not in, in the stress that they face. Next, please. So the most important thing that we are keeping in mind when we are doing all of these different life situations, whether travel, religious fast, whether it is a sick day routine, maybe a separate, short intercurrent period, but all these other life situations are completely long term for people at times, and it is our duty to take all this into consideration as an educator, to explain it to them. It is a lot of intel that you need to gather first, and the history taking that is done, and accordingly then advise it, and in tandem with their pattern of life, their work pattern, their lifestyle pattern, their exercise, how it has to be put in, because they shouldn't go hypo, and also most importantly with their glycemic control and the control of the other comorbid conditions. So it's quite a handful that we need to look into, but the good job is only done when all this is covered. Thank you so much.